Sayana Press, a contraceptive that is thought to be transforming family planning in Africa. It comes as a full package ready to use in 0.67 ml. This woman in Uganda's Mubende district is among the 35 respondents that are being used in a study by PATH. Referred to as number 4121019, she demonstrates how to self-inject the drug. She uses a condom filled with salt to show her skill. With 2 children to her name, number 4121019 says Sayana Press is the best contraceptive so far because it comes in small quantities and is easy to use. At Mubende District's Cancero Health Center too, women gather for various health services, among them family planning. Sarah Contina, a registered nurse working with PATH, is happy with the women's response to Sayana Press. She says out of the 35 women that have been using the contraceptive for 9 months now, only one has had intermenstrual bleeding.
With Sayana Press, those ones who have been injecting, I haven't had so many problems. These women were vigilant, they learned how to self-inject, and they have been injecting.
And in Zambia, the Zambia Medicines Regulatory Authority has approved the use of Sayana Press. The Ministry of Health has already procured 200,000 international units of Sayana Press and is piloting its use in 3 districts, namely Kalulushi, Kawambwa and Mafinga. Dr. Kennedy Malama, the ministry spokesperson, says so far, so good.
Similar to Depo-Provera, but this one is given Depo-Provera, we give it through what we call intramuscular. In other words, you inject in the muscle. The Sayana Press, you do it just below the skin, and you give it every 3 months. So what we've done as government is to start with a pilot, and we are in Kalulushi, Kawambwa and Mafinga. And the information we have on the ground is that, there is overwhelming response. And in fact, our mothers, our women and families are saying, this is what we need.
It's however quick to note that findings from the pilot would determine whether Zambia should take the route of Uganda of teaching women to self-inject the contraceptive.
In Zambia, we've moved a stage where community-based distributors, in other words, these are people from the communities who have been trained to give Depo-Provera, and it's the same with Sayana Press. We haven't yet made a decision where mothers should be able to give themselves. I think the pilot is going to tell us a lot of information and what our mothers are proposing.
With Zambia's fertility rate standing at between 5.3 in 2014 and 5.6 in 2016, it is prudent that many women embrace modern family planning methods, as planned families also translate into poverty reduction, quality education, and good healthcare provision. Ruth Kamwi, TV2 News in Lusaka.